you doing?
I just made so many mistakes doing that Foley. Like, I didn't wash my hands. I didn't ID the patient. I left the bag on the bed. I didn't even put it where it was supposed to be. Like, I'm so mad. Like.
No, I mean, you were a little nervous. It was your first time, you know? It's okay. And we definitely make mistakes, so I think that what I have here is a great idea. I brought some information for us so we can learn from the mistakes that we made.
Okay.
And maybe we can stop them from happening again, okay?
Okay.
Here's some for you, and I have some too. So why don't you explain some of the things that I gave you?
Okay. Maintaining sterility of urinary catheter during insertion of indwelling urinary catheter is priority in preventing infection from the catheter. If the catheter becomes contaminated while you're trying to insert it, you should grab a new one from the supply closet. Practices that can increase CAUTI, which is a catheter-acquired urinary tract infection.
Emerald, very good.
Thank you. Are irrigating indwelling catheters, disconnecting it from tubing, replacing the catheters unless it's obstructed, and using the same catheter after it failed for insertion the first time. You also want to empty the collection bag when it's 2/3 full, so there's no urinary backflow. And daily catheter care is really important in keeping the area clean.
Very good. Are you all done with your information, Emerald?
Yes.
Okay. I found a few things that were actually really interesting. We did a survey here at the hospital, and we got some statistics, and we found out that 78% of catheters were secured. So that means 20% of those catheters weren't secured. Did you secure your catheter?
I did. I used tape, but ideally you would use skin protectant, which helps keep the skin intact, and it's better for the skin.
So a leg bag, right?
Right. And a secure lock, too.
So every catheter wasn't secured. Every patient had a higher risk of a CAUTI. Another survey showed that only 56% of patients had the drainage tubing straight without dependent loops or kinks. So that 44% of patients did have obstructed urine flow related to dependent loops or kinks, all because of the tubing. So you always want to secure the tubing to prevent the catheter from moving and from urethral traction. We said the skin prep, which is also so important. And we also want to make sure the bag is where?
Below the height of the bladder.
Yes, and where did Emerald put it?
On the bed.
On the bed. Not a good idea. We always want to make sure it's below the bladder. We want to limit the duration of catheterization. So you want to talk to the provider, get them on the phone, and review the need for the catheter. You only want to insert that catheter if it's appropriate. So our patient was post-op hysterectomy. Was that catheter appropriate for her?
Because she was retaining urine, yeah.
Exactly. If she was stress incontinence, would that be a good idea?
No, probably.
Probably not. We want to, obviously the best prevention is?
To not put a catheter in if it's not absolutely necessary.
Exactly. So you want to avoid it. That's the best way to prevent it. So other ways you can implement, like alternatives to inserting a catheter, could definitely be using a bladder scanner to see how much volume of urine is in that bladder. You can use an external condom catheter for a male patient, and you could also use intermittent straight catheterization. So do you think that you've learned a lot from this information?
Definitely between putting it in and this stuff, I definitely feel like my next time will be a lot better.
Okay, we want to make sure that you're more confident next time. Confidence is key. Try not to get so nervous, and I think if you just use this information, a lot of the complications and these little helpful hints will be really good for you next time, okay?
I think so too.
Okay, good.